My name is Ben Ignolino, and I work at the Asian Pacific Islander Wellness Center in San Francisco, California. Asian Pacific Islander Wellness Center is a federally qualified health center. We believe everyone deserves to be healthy and have access to high-quality health care. This online platform is supported by funding from the Center for Disease Control and Prevention, the Division of HIV/AIDS Capacity Building Branch, and from the California Department of Public Health, Office of AIDS. Today, we're going to be providing a training and a webinar through our partners at AIDS United. Our guest presenters are Kelly Stevens and Sarah Getachow. I will let you know that during the webinar, we actually work in the Tenderloin district of San Francisco, so you may hear some sirens from oncoming traffic and ambulances, so please roll with us. It's going to be a really dynamic and fun and engaging webinar. As a capacity builder, we provide trainings and consultations in person, online, and through our platform. So if you're interested in learning more about what we do or learn more about what capacity building is through our partners at AIDS United, please let us know. If you have any questions before we begin the webinar, please use the chat feature if you're having difficulties with logging in or you're noticing some kind of disruption. Please feel free to just put it in the chat and we'll address it. We do have individuals who are watching it on the tech side and the back side for this webinar. Today's webinar is called Primer on PrEP. And we are extremely honored to have Kelly Stevens and Sarah Getachow present to you for the next hour and a half almost on a topic that has been raised and created urgency within the field. So without further ado, I'd like to share and begin with introducing our presenters.
Great. Awesome. Thank you, Ben. And thank you all for joining us here today. Before we begin our overview of PrEP, I'd like to take a few moments to share just a little bit about who we are and some of the work that we do. So as Ben shared, my name is Kelly Stevens, and I'm a program manager here at AIDS United. And I'm joined by my colleague.
Hi, everyone. My name is Sarah Getachow. I'm also a program associate and trainer at AIDS United.
And Sarah and I make up one half of AIDS United's Getting to Zero Capacity Building Assistance Program. So a little bit about AIDS United. AIDS United is an AIDS service organization located in Washington, D.C. And for almost 3 decades, AIDS United has supported community-driven responses to the HIV epidemic around the country that reach the nation's most disproportionately affected populations. Our organization engages in and supports a wide spectrum of programs and initiatives, all of which fall within our 4 overarching pillars kind of that frame the work that we do. And those pillars include strategic grant making, policy and advocacy engagement, formative research, and capacity building efforts. All right. At AIDS United, the Getting to Zero program focuses exclusively on providing capacity building assistance to community-based organizations across the country. And this effort is supported with funds from the Center of Disease Control and Prevention and is positioned to provide no-cost technical assistance and training services that are grounded in high-impact prevention or HIP strategies. All right. The Getting to Zero team is comprised of seasoned public health professionals who bring decades of cumulative experience successfully leading, managing, and growing community-based agencies and programs. And towards the end of the webinar, we'll share some additional information on how you can request free SIVA services from AIDS United. So please do stay tuned for that. Now, I'm going to go ahead and pass the baton over to Sarah, who's going to walk us through the agenda for today's PrEP 101 webinar. Sarah?
So our webinar is really going to be divided into 2 halves. So the first half of the webinar will be focusing on PrEP in the body, recommendations and guidelines surrounding PrEP use, and the PrEP medication pipeline. So this pipeline is going to discuss what medications are on the horizon for usage as PrEP. In the second half, we'll be covering PrEP adherence with different subpopulations, including adolescents, women, MSM, trans women, and people who inject drugs. We'll also be discussing drug interactions and side effects that come along with PrEP. And lastly, we'll go over some common cost and payment resources used for PrEP. And in our wrap-up, we'll open the discussion up for questions. Great. So we'll start off by discussing PrEP in the body. So in this section, we'll be defining what Truvada is, how it's prescribed and used, and how it interacts in the body when it's taken as prescribed. Okay, so what is PrEP? PrEP stands for pre-exposure prophylaxis. The word prophylaxis actually means any measures designed to preserve health and prevent the spread of disease. In this case, PrEP is an HIV medication that someone without HIV takes to prevent infection. If taken as prescribed, PrEP can actually be over 90% effective in preventing HIV. Right now, only one medication is approved as PrEP for individuals who are HIV negative. This medication is Truvada, which was approved by the FDA in July of 2012. Currently, there are several other HIV treatments that are being studied for their effectiveness as PrEP, and it's very likely in the next 5 to 6 years, our options for PrEP will greatly increase. So we'll be talking about the PrEP pipeline a bit later in this presentation. But the ultimate goal of PrEP is really to reduce the acquisition of HIV infection along with its resulting morbidity, mortality, and costs to individuals. So what is PrEP? So here are some helpful takeaway messages about PrEP that can help you in terms of understanding what you need to know about PrEP. So these are very valuable take-home messages. So Truvada is an HIV prevention medication for people who are not living with HIV. It's taken as one pill and should be taken once daily. The medication blocks important pathways that HIV uses to set up infection in the body. We'll be talking about what pathway Truvada blocks a bit later in this presentation. So an HIV test is required before starting PrEP and then every 2 to 3 months while taking PrEP. Providers aren't prescribing PrEP without a documented HIV test, and that HIV test would have to have been done within the past 3 months. So most of the time, prescribers won't prescribe more than 3 months worth of PrEP so that clients can come back for an HIV test every 3 months. PrEP can be prescribed by any healthcare provider. So any healthcare provider that can write a prescription can prescribe PrEP. This includes a nurse practitioner, a physician's assistant, and of course, a medical doctor. Some healthcare providers think they're unable to prescribe PrEP and may recommend that clients go to an HIV specialist. Then in reality, they do have the ability to prescribe PrEP. So our Getting to Zero team has developed a PrEP toolkit, which is a comprehensive resource for community-based organizations with information about PrEP. We'll be touching on this resource a bit later, but the toolkit does have information for how clients can talk to their medical providers about PrEP and how we as providers can prepare our clients for having these conversations with their medical providers. So common forms of PrEP. We talked about Truvada, which is what the FDA has approved as PrEP, but Truvada is actually made up of 2 medications. It's made up of 300 milligrams of tenofovir and 200 milligrams of emtricitabine. The trade name for tenofovir is Viared, and the trade name for emtricitabine is Emtriva. Providers can also prescribe 300 milligrams of tenofovir and 200 milligrams of emtricitabine to patients to be taken together as PrEP. So both of these medications would be taken once a day. Depending on your client's insurance plan, it may be cheaper to purchase tenofovir and emtricitabine separately. But it's important to note that if your client tells you they're taking Truvada or that they're taking a combination of tenofovir and emtricitabine, both are forms of PrEP. So for the past 10 years, tenofovir and emtricitabine, the 2 medications that make up Truvada, have also been used as common antiretroviral treatments taken for HIV infection. So there are many people who are currently living with HIV who are using tenofovir and emtricitabine, among other medications, as treatment for HIV. So moving on, HIV in the body. So we talked about how PrEP blocks an important pathway that HIV uses to set up infection in the body. So to really understand what pathway PrEP blocks, we're going to quickly go over what HIV does in the body. So HIV, as you all know, stands for human immunodeficiency virus, and it attacks the immune system. The immune system is comprised of white blood cells, which fight off infection. So when a virus enters a body, the immune system is activated, and it's your first line of defense. HIV infects the CD4 cells, which are a type of white blood cell found in your immune system. The CD4 cells have several functions. Their two major functions are first, they release chemicals that attract other white blood cells to the site of an infection to attack the virus. Secondly, CD4 cells release antibodies, which are markers that can identify the same virus throughout your body, and these antibodies attach to the virus, marking them for destruction by the immune system. CD4 cells are really essential to fighting off infections. So the cell you see in this slide is actually a CD4 cell. The blue virus you see is the HIV virus. So HIV is a retrovirus, meaning it has an outer envelope and 2 copies of RNA. And also inside the envelope, it has 3 enzymes that are called reverse transcriptase, integrase, and protease. The first one, the HIV virus, identifies the CD4 cell. The outer envelope of the virus attaches to the CD4 cell and fuses with it, dumping its contents into the CD4 cell. Like I said before, HIV comes in with 2 copies of RNA, and our genetic code is made up of double-stranded DNA. So the virus uses reverse transcriptase to convert the viral RNA into viral DNA. Next, integrase carries that viral DNA into the nucleus and integrates it with our DNA, or our genetic code. This step is extremely important because this is what establishes a lifelong infection. So after HIV becomes integrated into our DNA, the next step is to construct the building blocks for new HIV viruses. And protease aids in the development of new HIV viruses. So once these viruses mature, they're able to attack other CD4 cells. In this process, HIV sets up infection in the body and can replicate itself billions of times daily. Moving on, antiretroviral therapy. As we talked about before, antiretroviral therapy are medications used to treat HIV. This isn't a cure for HIV, but can suppress the virus so that it becomes undetectable. As I mentioned before, tenofovir and emtricitabine are 2 medications that make up Truvada, but they're also 2 very common types of antiretroviral therapy medications. There are several different forms of antiretroviral therapy. First, we have entry or fusion inhibitors. These interfere with the virus's ability to bind with the outer surface of the CD4 cell. Next, we have the reverse transcriptase inhibitors. These prevent the HIV enzyme reverse transcriptase from converting viral RNA into viral DNA. Next, we have the integrase inhibitors. These block the HIV enzyme integrase, which the virus uses to integrate its genetic material into the DNA of the cell it has infected. Next, we have the protease inhibitors, and this interferes with the HIV enzyme protease, which helps assemble new HIV viruses. Lastly, we have maturation inhibitors. These inhibit the maturation of new HIV viruses. There are many benefits to antiretroviral therapy. ART can suppress the HIV virus, and when taken and adhered to, it can reduce the risk of transmitting HIV by up to 96%. ART can also greatly prolong the lifespan and quality of life of people who are living with HIV. The Truvada is actually a reverse transcriptase inhibitor. It prevents the HIV enzyme reverse transcriptase from converting viral RNA into viral DNA and prevents HIV from establishing a lifelong infection.
So thank you, Sarah. Sarah just provided some information on what PrEP is and the common forms of PrEP. And she also walked us through the cycle of HIV from seroconversion to replication and talked about how antiretroviral drugs work in the body to inhibit the virus at various stages. All right, so now let's talk a little bit about some guidelines and recommendations for PrEP. That slide is coming up. Awesome. Great. So who should take PrEP? So generally speaking, PrEP should be considered an HIV prevention tool for anyone who is HIV negative but feels as though they might be exposed to HIV through either sexual activity or drug use. According to guidelines released by the United States Public Health Services, PrEP is strongly recommended for sexually active gay, bisexual, or other men who have sex with men, heterosexually active adult men and women at high risk for acquisition of HIV, HIV negative individuals in relationships with HIV positive persons. This is otherwise known as a serodifferent or serodiscordant relationship, where one partner is HIV positive and the other is HIV negative, and people who inject drugs. There's also a strong push for young people aged 13 to 18 who are at high risk for contracting HIV to also be prescribed PrEP as a part of a combination prevention strategy. So here we have the 6 major PrEP trials that have been published and are widely referenced in support of PrEP as an HIV prevention tool. For the purpose of this webinar, I'm not going to go into too much detail about each of these trials, but do want to point out that of the 6, there were some that indicated high evidence of drug efficacy or the ability for the drug to demonstrate that it works as intended, and there were other trials that reported low evidence of drug efficacy. So among those trials that reported evidence of high efficacy, the populations that were examined were men who have sex with men, and that was within the I-PrEP study, serodiscordant couples, and that was within the Partners PrEP study, and injection drug users, and that was found within the Bangkok's tenofovir study. It's also worth mentioning that the 2 PrEP trials that focused on women at high risk both showed little evidence of PrEP efficacy. Those trials were the PrEP trial and the VOICE trial at the bottom of that chart there. It's believed that the low efficacy rate is possibly due to the low drug adherence among the study participants. So the take-home message here is that adherence was the biggest factor that determined whether or not PrEP was effective. So this nifty graph that you have in front of you depicts the outcome of 4 of the PrEP trials as they relate to adherence levels and PrEP effectiveness in protecting against HIV. Again, what the studies are telling us is that adherence and PrEP effectiveness are inextricably linked. And when taken properly and adhered to, PrEP is estimated to be over 90% effective against HIV. Scientists remain pretty torn about how long it takes for PrEP to provide maximum protection against HIV once you start taking it. Some studies suggest that if you take PrEP every day, it reaches its maximum protection in blood at 20 days, so about a month. And in rectal tissue, it takes about 7 days, and in vaginal tissues, again, about 20 days. Go on to the next slide. So in summary, federal guidelines recommend that PrEP be considered for people who are HIV negative at substantial risk for HIV infection. So as it relates to sexual transmission, this includes anyone who is in an ongoing relationship with an HIV positive partner, and also can include gay or bisexual men who have had anal sex without a condom or been diagnosed with an STD in the past 6 months, or heterosexual men and women who do not regularly use condoms during sex with partners of unknown HIV status, particularly if those partners fall into high-risk groups, such as people who inject drugs. And as it relates to people who inject drugs, this recommendation includes those who have injected illicit drugs within the past 6 months, those who've shared injection equipment, and those who've been in drug treatment for injection drug use within the past 6 months. The recommendations also state that healthcare providers discuss PrEP with heterosexual couples in which one partner is HIV positive and the other HIV negative, again, serodiscordant couples, as one of several options to protect the partner who is HIV negative during conception and during pregnancy.
Moving on, what's on the horizon? A bit earlier, I mentioned the PrEP pipeline. So we're going to transition into talking about the PrEP pipeline. And although currently Truvada is the only medication that's approved to be used as PrEP, there are at least 6 antiretroviral drugs currently being tested for usage as PrEP. So these drugs are in different phases in clinical studies and are being tried in combination with different delivery systems. But taking a look at this next chart, you can see in the table on the right-hand corner, labeled as active drug, you have a list of all the antiretroviral drugs that are currently being tested for effectiveness, and in the table right next to it labeled delivery systems, you have the different delivery methods for how these medications are being administered. So in terms of delivery systems, we have the oral tablet. So Truvada is currently approved as an oral medication, but several other oral tablets are also being tested for effectiveness. We also have the vaginal ring. Vaginal ring is a flexible ring. It's inserted into the vagina, and it can remain in place for weeks at a time. So this ring is infused with a drug, and it slowly releases the drug into the body. There's also the vaginal film. So this is a thin film that, once inserted into vagina, will dissolve into a gel, and this will also deliver the drug into the body via absorption over a period of time. There's also the vaginal tablet. This is a tablet inserted into the vagina, and it dissolves and delivers the drug by absorption. We have the vaginal gel. That's a gel inserted into the vagina, and it delivers the drug into the body also by absorption. Next, we also have the long-acting injection. So this is an intramuscular injection that's administered every 3 months. The trials for injectable PrEP are testing efficacy for up to 3 months at a time, which is very promising, as it would reduce the burden on the user by reducing the daily dosage from a day to every 3 months. And lastly, we have the rectal gel, which is a microbicidial gel that's self-administered in the rectal cavity prior to anal sex. So as you can see, there are several different drugs and delivery methods that are being tested for usage as PrEP. But in reality, it'll take several years for any of these new drugs or delivery methods to be approved. So we still really need to ensure that our clients are being fully supported via the oral Truvada tablet. So this really concludes the first half of our webinar. We're going to go now into a short recap over the information that we've just covered.
So to recap, we're going to have a set of questions. Go ahead and place your responses to these questions in the chat box feature online, and then we'll go from there and we'll reveal the answer. So first, what PrEP stands for what? And we're going to give you a couple seconds to go ahead and put in your response. What are we seeing? Is there anything? All right, let's do reveal.
So the reveal, PrEP stands for pre-exposure prophylaxis. So as Sarah mentioned, the term prophylaxis is actually not specific to HIV. The word itself refers really to any measure designed to preserve health and prevent the spread of a disease. So as it relates to HIV pre-exposure prophylaxis, or PrEP, refers to the set of drugs that work to preserve health and prevent against the spread of HIV prior to HIV exposure.
Great. All right, we have another recap question. PrEP establishes the maximum level of protection against HIV after. Go ahead and fill in your responses. Again, let me say that again. PrEP establishes the maximum level of protection against HIV after. All right, community, what's the answer? All right.
So here's the answer. So we talked about this briefly, but PrEP actually establishes maximum levels of protection differently in different tissues. So in rectal tissues, maximum effectiveness is established in about 7 days or 1 week. In vaginal tissues and blood, it takes about 20 days of consistent Truvada use to reach maximum effectiveness. Again, that means that they have to consistently be taking it once a day. it is also important to note that when we're talking about effective messaging, it can get a little bit confusing talking about the different days that it takes for PrEP to establish maximum protection in different tissues. So most providers have resorted to saying about a month to sort of have consistent messaging across the board and let their clients know that within a month of consistent PrEP use, again, that's once every day, they'll reach maximum level of protection.
Fantastic.